everyone, welcome back to my channel, and this is Nurse Kurleen. I'm going to help you break down the most important topic that is for anyone who is thinking to have a career in healthcare in Canada. The difference between PSW, RPN or LPN and RN. I'm going to explain each category with everything you need to know about each category and how you can bridge between these. This is one of the biggest questions I always get asked from a lot of students or non-healthcare professionals who want to get into healthcare, that we really want to know about what each of the categories mean and how it can be done and what the scope of practice. So in this video, I'm going to compile everything, like literally everything in one umbrella. Comments what you think about these categories and which pathway you will choose at the end of this video. Let's get started. Let's dive with the basic foundation, schooling. Because for a lot of people, this is the basic question that I get asked. This is the biggest factor as compared to all other factors. Firstly, we'll talk about personal support worker. To become a personal support worker or a PSW or a healthcare assistant or a healthcare aide in Ontario, you need to complete 12 months of certificate program. Now, this can be done in any public or private college. I would suggest you here really look into your career pathway, because in future, if you want to bridge from PSW to RPN or LPN, which I will explain further in this video, you will need to at least have a public college certificate. Some colleges do accept private colleges certificate as well, but if you're targeting a specific public college for your RPN or LPN in the future, you must get the requirements right from the basics. A lot of people choose this pathway from PSW to RPN and then RN. So this is for those people. But who just want to be PSW, you can skip that information. PSW certificate is actually the fastest way you can get into healthcare. Of course, focuses more on personal care and therapeutic communication, mobility assistance, or assistance in daily living. Usually for this course, the placements happen in long-term care, community settings. Most of the time that I have seen, I have witnessed students, they are having their placements only in long-term care facilities, which is a full-time placement work of 200 to 300 hours, depending on the college that you go to. If you do a certain minimum hours of volunteering work, because I know some colleges do accept your volunteering work as part of your clinical hours. So if you want to get into healthcare, but you don't want to commit to a long diploma or degree, PSW is the fastest and the easiest way. Let's talk about RPN or LPN. RPN is a registered practical nurse or licensed practical nurse. This requires a minimum of 2 years of diploma at any community college. I'm saying community college because in Ontario, community colleges are much affordable for the residents or for the immigrants as compared to the private colleges, and community colleges are more recognized as compared to the private colleges. RPNs are nurses, so you are going to learn more about medical side of the healthcare. Not only just hands-on care or communication or mobility assistance, you're going to learn about pharmacology, how certain diseases start and work, and how you treat them, how you diagnose them. You don't make any official diagnosis, but you learn how to catch the symptoms of early starting of disease and convey it to the doctor. Clinical placements usually take place in community setting, hospitals, or rehab. Now, hospitals come into place in this community setting because you are paired with the nurse in your last semester. Basically, you have to complete around 400 to 450 hours of clinical placement. Some colleges also require you to do volunteering in your first and second semester. So basically, your placement starts in second semester and then continue in third and fourth semester is your consolidation. Some colleges do have fifth semester as well. So it depends on the college you want to go to. Just research the requirements beforehand. RPN is usually a balance between shorter school time, real nursing responsibility. And then last comes out RNs or registered nurses. In order to become a registered nurse, you have to have at least 4 years of degree. Now, bachelor's of science in nursing is the only degree that you can do in order to become RN or registered nurse. So for RPN and RN, you have to be licensed. So you have to give a license exam that is REXPN for RPNs and NCLEX RN for RNs. RN is more in-depth training, and you will learn about how to be a leader, because usually RNs are unit leaders. They work in high acute care environment like emergency, ICU, mental health departments, because these departments actually require you to have more in-depth knowledge of everything that you will learn in your foundation. This is the most time-consuming from all the pathways that I talked before. Now let's talk about job duty. This is where a role differs the most. First of all, PSWs, they work very hands-on with the patients. This is what they do. They do personal care. They take care of the hygiene of the patients. They are the ones who are involved in direct patient care. They give emotional support to the patient. They help the people to stay independent because they help in mobilizing the patient, walking or just doing some exercises with the patient. This profession is not regulated, so you don't need any license to become a PSW. However, you have to pass NACC exam in Ontario. Next comes the RPN. RPNs actually provide care to more stable and predictable patients. These nurses work in hospitals and long-term care and community setting, residential homes, just name it. These nurses work with less critical patients. They do the medications, dressing, vitals, catheter, blood glucose, and labs. Some RPNs do withdraw bloods in some facilities, and they collaborate with the registered nurses or doctors to take care of the patient. When it comes to RNs, RNs are usually in charge nurses. They handle the full care plan of the patient. They do full care assessment, emergency management, because RNs work in high acute care environments. They do IV medication and lead the healthcare team. Now let's talk about salary of each of the profession to have an idea of what are you going to make after you do the diploma or certificate or the degree. PSWs have the lowest pay of all the three professions that I'm talking about. In Ontario, typically they earn around $20 an hour to $28 an hour if you're very highly experienced. If you work in a community setting as a PSW, you are paid for your mileage and your car fuel as well, because I personally worked as a community PSW when I was a nursing student, so I know a little bit of the community healthcare. Hospitals, you get paid a little bit more than long-term care and community settings, but the jobs are not as much as you can find in long-term care or community settings. Next comes our RPNs. RPNs are middle of PSW and RN. Basically, RPNs start from $29 an hour to $38, $39 an hour, depending on the area you're working in. Hospitals usually pay the most to RPNs. These they get paid in residential homes or long-term care homes. Next come the RNs. RNs are the most paid in all three professions because of their knowledge and the high acute care environment they work at. They start from anywhere around $41 up to $55 to $60, depending on their experience and their environment they're working at. And also it depends on the area you're working at. If you go outside of GTA, there are more chances that you will be getting paid higher as compared to in the GTA. Which pathway is right for you? This is the question that comes into everybody's mind whenever we are just starting a career in healthcare. So basically, if you're a person who enjoys giving personal care and more hands-on experience and talking to patients, socializing with patients, but all commit long time to studying, PSW certificate is best for you. If you want to be a nurse, but you don't want to commit 4 years to your studying, then I think becoming an RPN or LPN is going to be best for you. And at last, if you want to be a leader, you want to be in charge nurse, or you want to do more of the acute care stuff, then becoming an RN will be a great pathway for you. Talk about bridging options. There are a great deal of bridging options that are available in Ontario. If you choose PSW and after working as a PSW for some years, you want to become an RPN, there is a pathway available, PSW to RPN, in which you can complete your RPN in just 16 months. Some colleges do offer you 1 semester of bridging and then you go directly into the second semester of nursing. However, some schools, they offer you the basic pathway that they will give you 1 semester of bridging and then you start from the first semester of your nursing in the diploma of nursing. There's RPN or LPN. Then if you're working as an RPN for some time and you want to bridge to RN, there are plenty of options available for you to become an RN from RPN. This is known as RPN to RN bridging. And some colleges do offer you 2 semesters of bridging and then you go directly into 3rd year of your RN degree. Some universities also offer fully online courses. You can do it part-time, full-time, you name it. It's all about today's nursing knowledge. Let me know in the comments which pathway you think that is going to be better for you guys, why you are choosing. I love helping future healthcare people, and do subscribe my channel for more educational content. Share this video to someone who needs clarity in all three professions. Take care, and I'll see you next video.